I am here with Dr. Josepha Cheong. She's a professor at University of Florida and Assistant Chief of Psychiatry at Nashville VA Medical Center. Thanks for joining us today.
Thank you for having me here.
So explain the top 10 geriatric psychiatry issues.
The top 10, this is a workshop that we've been doing for about, I guess, almost 5 or 6 years. And my colleague and I, Iqbal Ahmed from the Tripler Medical in Honolulu and with the University of Hawaii, we've been doing this, and we're going over in terms of what are the top 10 things that a general psychiatrist would want to know or should know about managing an older adult. Because whether or not you claim to be a general psychiatrist, a geriatric psychiatrist, you're going to have geriatric patients in your practice. And so we just started playing around with, like, what are the questions we always get at the sidewalk consult, where people are like, hey, I don't need a full consult, but tell me something. You know, my grandmother just got put on haloperidol. What does that mean? And so we kind of ask colleagues, and this the kind of the top 10, and we update it every year. So it's a lot of fun.
With the aging population, I mean, I imagine there's more and more people that have these questions.
Absolutely, because more and more people are taking care of their parents. In fact, the great majority of elderly patients who are having some sort of care, it's an informal caregiver or it's a primary care physician, so not even someone who is specialized in geriatrics. And you don't have to be in geriatrics to take care of geriatrics, you just have to be aware of certain issues.
Well, take us through some of these. I understand one of them was about driving.
Driving's a big one. In terms of, like, the usual question is like, you know, my dad's 78 years old, he's never been in an accident, but I'm a little worried about him. But he doesn't want to give up driving, I don't want to do that. So you try to do it as a kind of find out first, establish why the concern. Because is it just because he's 78, or is it because something has happened? And just ask some general questions in terms of, well, has he gotten lost in familiar places? First and foremost, have a very good physical exam. Check with the doctor. Physical health is everything. And then also explain that if they're starting to get lost or they're starting to have forgetfulness, that to start thinking about how complex an issue driving is. I mean, to drive, you have to make 1,000 split-second decisions. And so someone with even a mild cognitive impairment is at such a great risk of having an event. The usual thing is make sure there's a good physical exam, then do a mental status and see whether or not there's any cognitive impairment. Then it gets the tougher thing. How do you take the keys away? You know, so
well, there's pride involved.
There is pride involved.
It's an emotional thing.
It is a very emotional thing. Particularly, I'm sure it's like this in Canada, but in America, cars are freedom. Cars are being, you know, it's like that's the open road. It's the thing that you're your own man. You're your own person. It's driving a car. One of the key things, and we even go to certain things that are like, well, my dad's never going to give us the keys, and I'll say things like, well, then you disable the car, pull out the spark plugs, steal the battery, say certain things like, well, the car's in the shop, and it's tough.
Not easy.
It is tough, but do it with the help of a physician. That'll help.
What about elderly making decisions themselves? I mean, how do you decide?
That's a key question. Particularly, one of the key things is to think about advanced directives, and truthfully, all of us should have advanced directives, meaning that we've written out and discussed with someone we trust what we would want done when we can't make that decision. It is never too early to talk about advanced directives, and it should be reviewed each time a patient comes into the office. It's just, do you have a set of advanced directives? What if in the event you're in an accident and you can't tell someone about how you want your treatment, how long you want to be treated for? That's a key thing. It's never too early to talk about advanced directives. Consultation.
Great. And quickly, what do you look for the most?
At the APA? Well, there's just so many fantastic speakers. I mean, there are, and to see someone up close that you've always read, and there they are, and you get to ask the questions. And then even more than that is meeting new people, and even more than that is meeting good friends. To me, the APA is all of that. It's a really great time.
Dr. Josepha Cheong, thank you so much.
Thank you very much. Very nice meeting you. Thank you for having me.